So, I would like to start with this beautiful quote that I recently came across. If concentration is an art, then a surgeon may be the greatest artist. With this, I would like to wish everyone a very heartiest welcome. I'm here to present my topic. Orthognathic surgery has a significant effect on perceived personality traits and emotional expression. So, before we go into the depth of the topic, we need to know what is orthognathic surgery. So let's rewind to our history lessons a bit. The word orthognathic comes from the language Greek, and where orthos means to straighten and gnathos means jaw. It is basically manipulation of the facial structure to achieve an anatomical and functional relationship. So, when do we need an orthognathic surgery? Whenever there is a dentofacial deformity, or there can be a dentofacial deformity that can have a physical or a psychosocial problem, or that can cause one. So, this can be due to an underlying genetic predisposition, congenital anomaly, traumatic events, neoplastic growth, surgical resection, and iatrogenic radiation. Now the question is, why do we need orthognathic surgery? So as mentioned earlier, if there's a dentofacial deformity, there can be a physical effect, there can be an aesthetical effect, and there can be a psychosocial effect. Now when we're talking about this psychological effect, we mean that it impacts one's psychology. But when there's a psychosocial effect, it also impacts on whether how differently a person in front of us is perceiving us. So, leading from this question, another question arises. Can facial bone structure influence on how people see you? Well, answer to this is yes. A study conducted by Heyman et al., it was said that when a person has a happy facial expression, as in where there's upturned eyebrow and there's an upward curving of the mouth, the patient appears to be more trustworthy. And when there's a thinnish facial structure, the patient appears to be more less competent, and when there's a wider facial structure, the patient appears to be more competent. So now going to the depth of the topic, effect on perceived personality traits and emotional expression. So there was a study conducted by Poshnik in the year 2017. The purpose of this study was to assess a layperson's social perception of a dentofacially deformed subject before and after orthognathic surgery. The null hypothesis for this study was orthognathic surgery would make no difference or no improvement in perceived personality traits or perceived emotional facial expression. The design of the study, there were 20 subjects selected randomly from a dentofacial deformed database. 500 respondents were selected to complete the study. The selection criteria was bimaxillary and chin orthognathic surgery, all treated by one surgeon. Then comparison of 6 perceived personality traits and 6 perceived emotional traits were considered before and 6 months after the orthognathic surgery was performed. And a descriptive statistical analysis was performed. So the scales used in the study were personality trait and emotional expression. So in personality trait, on one end we can see we have submissive, on the other end we can see we have dominant. Similarly, we have trustworthy, untrustworthy, threatening, non-threatening, friendly, unfriendly, intelligent, unintelligent, attractive, unattractive. In emotional expressions, we have the following expressions: angry, surprised, happy, sad, afraid, and disgusted. Now, this is a preoperative photograph and a post-operative photograph. In this, we can see the patient's personality traits have changed according to the perception of respondents as more dominant, more trustworthy, more threatening, more friendly, more intelligent, more attractive. In emotional expressions, the patient appears to be less angry, more surprised, happier, less sad, less afraid, and less disgusted. In the conclusion of this first study, the null hypothesis is rejected, and there's a significant difference in the perceived personality traits and emotional expressions after the orthognathic surgery than before the surgery. In another study conducted by Massafero in the year 2019, the preoperative and the postoperative photographs show the following difference according to the respondents. The patient appears to be more dominant, more trustworthy, less threatening, more friendly, more intelligent, and more attractive. According to emotional expressions, the patient appears to be less angry, less surprised, happier, less sad, less afraid, and less disgusted. In conclusion of this study, the null hypothesis is rejected, and the Patients' personality traits and emotional expressions appear to be more positive after orthognathic surgery than before surgery. So, in conclusion of the overall study, the orthognathic surgery has a significant positive effect on perceived personality traits and perceived emotional expression. Now, one reason for this could be that nature believes in symmetry. Now, when we say nature believes in symmetry, we all know that we are surrounded by symmetrical patterns in and around nature. For example, in flowers, fruits, spiderwebs, acorn, and even snowflakes, and so much more. As per a study done by Brigato et al. In the year 2016, it was said that there is a positive shift towards the golden proportion after the orthognathic surgery. Now, this could be one reason why we are seeing a positive shift, because we do have a human tendency of having a fixed perception of beauty standards and a fixed perception of how a person looks. So, when there is a proportion achieved, that time a person starts looking more attractive, more happy. And if a person's looking more attractive and happy, he automatically becomes more approachable. So I would also like to add this point that these positive perceptions work in our favor, because when there is a positive perception, there's a positive psychosocial and psychological effect. And that is when we as surgeons have succeeded, because we are able to provide a wholesome quality treatment, because we are achieving all three areas of health: the physical, mental, and social part of health, which is why I think it is very important for us to treat person as a whole, and orthognathic surgery somewhere does help us achieve that. These are my references that I have referred for this paper presentation, and I would like to thank everybody for hearing me. Thank you.